good afternoon. Dear participants, dear colleagues here in Moscow and in BRICS countries, I'm glad to open the, I think, most important session of this 12th BRICS Academic Forum, which devoted to health. All of us, all world is now in a pandemic, and most important goal for us is to protect health of people around the world, protect health of people in our countries, and of course, science and academic community plays a pivotal role in this fight against pandemic, and especially during the pandemic, the role of science and coordination between scientists and exchange between scientists demonstrated the accelerated results in producing effective measures to prevent and control the pandemic. And more important is that it's not only scientists from epidemiology field or virological or health-related fields, but all science, especially from bioinformatics science, mathematical science, and others, digital academician community, also joined the efforts to save lives of people around the world. But we are not talking only about the COVID-19, but we should think, as our session says, should think not beyond pandemic. We should think about other emerging and well-known health-related problems, global problems, and how the science community from BRIC countries can contribute to tackle other major issues related to global health, such as HIV/AIDS, TB, nutrition, malnutrition, primary health care, and many other issues that people around the world facing in 21st century and 21st century. So I want to introduce to you our panelists, and I start with Georgy Lebedev, who is Director of Institute of Digital Medicine, Head of the Department of Information and Internet Technologies in First Moscow State Medical University, named after Sechenov. Further, I would like to introduce Dr. André de Mello Souza, researcher, Institute of Applied Economic Research of Brazil. Our next panelist will be Mr. Oman Kurian, Senior Fellow, Head of Health Initiative, Observer Research Foundation, India. Mr. Li Zhongzi, who is Director of Division of Infectious Disease Control, Chinese Center for Disease Control and Prevention, China CDC, Team Leader of the China CDC COVID-19 Emergency Response Technical Team. Good to see you. Dr. Aquina Tulare, member of South African BRICS think tank, South African National Department of Health, South Africa. Okay, she will be with us in 30 minutes. And finally, on my left side, Dr. Ildar Akhtamazyan, Associate Professor, Department of International Relations and Foreign Policy of Russia from Moscow State Institute of International Relations, after the Russian Ministry of Foreign Affairs. So I don't want to take any more time from our panelists. We have 1 hour and 30 minutes for our discussions, and hopefully we will be able to exchange views after all presentations will be made. My proposal is to give the floor in the order I just presented our panelists give the floor and to have some questions recently after the presentation, but discussion, to organize discussion after the whole presenters will present their thoughts to the auditorium. So thank you very much. And with this, I would like to give the floor to Professor Georgy Lebedev. Georgy Stanislavovich.
Thank you very much, Mr. Chair, dear colleagues. It is with great pleasure that I would like to share with you some of the research that we are doing in the domain of digital medicine and the areas where we would be very much interested in cooperating with our BRICS colleagues, especially in light of the development of various research technologies, and we would like also to use jointly some grants and projects to that. Let me also make my presentation. Well, the modern challenges because of the COVID-19 pandemic, of course, increased the role of digital medicine to a very high level. And the key areas of our research are scientific research, some new solutions in digital medicine, implementation of innovations in the operations of the clinical center. Actually, I represent here a leading establishment and a high institution which makes a lot of research, and we have a clinic also with 3,500 beds there, and all the medical professions are represented there. So our new solutions are also integrated into the educational process, and we also train our students who are future doctors in that, so that they understand what digital medicine is about. Also, 3 years ago, we started another educational program for engineers, and in a section of university, we also train sysadmins, engineers, so that they can develop technologies, implement them, and introduce them into the medical environment. Our educational program includes working with medics as well as with health administrators and professionals. And of course, modern medicine is about 4P, where you need to have the participation of patients in protecting their health. So we teach patients how to use digital technology so that they can monitor their state of health. And of course, our students, we more or less cover them all, and we train them in digital medical technologies. We also cover them in our educational processes and research. Digital medicine, of course, consists of several parts, telemedical systems and various technologies there. We have a number of telemedicine projects to trace and monitor the state of health of our patients. So consultations are a big thing there, quite well developed, and the question is how to provide help to a person remotely. Now, here we have several projects which are being implemented. First, monitoring patients with oncological diseases. Using telemedical technologies, we trace and monitor those people at home. So they receive some medicine, and we check the parameters. Probably what we are lacking would be to have some quick blood tests, like mobile stations that can provide a very quick blood test. If we can have that in the Russian Federation, a blood test which is simple to use and can be used by patients at home, then, of course, we can carry medical treatment to the home of patients. Second, of course, would be the treatment and monitoring of patients with urolithiasis and infectious diseases. We also can monitor pregnant women, and using telemedical technologies, we can also conduct monitoring. A very interesting international project is the home telemedicine respiratory support system using various technologies to help the patients with the lung diseases to actually stay home and provide enough comfort to them. This is the Department of Pulmonology of Air Liquide of France. Also, we are providing monitoring system for patients with spinal cord injuries together with our German colleagues. And we are now trying to develop an exoskeleton for the patients who can be used at home. And of course, here we would be very much interested in cooperation, and new solutions can be implemented in the Russian Federation, and we can offer also our solutions to our partners so that they can share from what we have developed so far. And of course, an important area of digital medicine would be the use of artificial intelligence to process medical data. And this is the slide which shows a number of important projects that we are implementing. The first one is about the creation of a university biobank of depersonalized data for training, calibration, and testing of artificial intelligence technologies, creating a system of intelligent access to a repository of clinical guidelines and other data, say texts about or reference books about certain diseases. So we also have an expert group of leading doctors at the university who can work with international literature and produce the clinical recommendations that can be used by doctors across the Russian Federation, and so that the doctors can be supported by others. So we are also creating robotic systems like robot disinfector and robotic arm, robo scans, etc. And we can put the robots into the COVID hot areas so that the robots can clean the area, and such a robot would prevent doctors going into the red zone, into the hot zone of the COVID hospitals. And the robot can be traveling inside, talking to patients, doing some minimal functions, testing blood pressure, maybe also check the readings of the oximeter, etc. We're also using different mathematical methods to analyze epidemiological situations, that is, calculating the rate of infections for the sake of our Ministry of Health. And here we're using mathematical methods. So we also are creating a laboratory of reference data sets. There are open data sets. Some of the data sets are developed internally by our universities. So, for example, we have a task. We have a lying patient, and there is a video camera which is watching the patient to kind of like to check on which side the patient is lying, etc. There are also smart bed solutions, and that smart bed can also assess the position of the patient with the gauges inside the bed. But we can do that with our video cameras, with our CCTV, which would identify the position of the patient. We know how much time was spent by the patient on one side and on the other side, for example. Then we can also recognize which nurse, for example, approached the patient. So we are creating the data sets for the manual operations of a nurse. For example, injections, changing linen, washing the patient, etc., etc. So we published more or less an article on that. We know about the standard and regular actions of a nurse, and we now can have more or less a data set created that the system automatically would trace what was done to a patient and what was not yet done. For example, for the palliative patients, we can do the same at home, so that we know what the nurse did to the patient at home while the patient is at home. Same stories about the operating tables. We have 14 operating rooms in one of the buildings of our university, and you can have the 14 pictures. So on the right-hand side, you see how the operating fields in the surgery room looks like. Again, we can see that we more or less have a patient on the table. There is a team of surgeons coming in, starting an operation, a surgery, and then the patient is removed from the table, from the operating table. You would think that this is quite simple, but you use neural networks to recognize the image, and the manager of all the 14 rooms of the surgery section would be able to kind of like receive a signal that the surgery is over and the operating room is vacant for another patient. Also, decision-making support to analyze medical texts. For example, we have more or less like a query system, a learning database which uses text mining methods and text recognition to produce solutions for a doctor. So we use some standard recommendations of a patient. So if a doctor cannot, decide what is the diagnosis of a patient, maybe very rare cases, for example, so we do the search and query across the text, and we use some reference articles. Up to 15,000 medical articles are published daily in the world. So we now are creating a system which would be very quick in finding those publications that relate to the patient, published in different languages. And our expert group in the section of university also can process such queries and the results of such searches so that they can fine-tune what a doctor needs. So these are the main areas of what we do. So we would appreciate very much if we can work together with you and probably look for some joint grants in the area of telemedicine and digital medicine and projects that are also carried out in the BRICS countries. Thank you very much.
Your presentation, I think that it's not a secret that digital technologies in health were boosted in the last several years, and especially last year, when the world, as I said, as I mentioned before, faced the public health crisis related to COVID-19. And I just want to mention that digital technologies, they raise the quality of health care, and they give the opportunity for doctors and clinicians and to balance their efforts and to save more lives, to take care, to provide care to more patients. And what is also important about digital technologies is that they also helped to implement preventive measures and help the people to take care of themselves, and especially when we talk about the social distancing, when we talk about the distant work, and when we talk about lockdowns, etc. Many of the digital technologies were very helpful to keep educational processes, to keep working processes, to keep economy alive, and they were boosted. Especially, I just to give an example of Russian Federation, that the during several months, the many services that provided by the state were put in the transferred in the digital area and became digital, and people receive quality and quality services from the state during the pandemic, even in a faster mode, response that was given by the population to these services was quite a positive, and gave the state the opportunity to move even further and put new target of digitalization of state services and other services closer to 2020 from, for example, 2023 in the National Program of Digitalization. So before I give the floor to Dr. Andrea de Mello de Souza, I want to mention that his main areas of research include the global governance and health, intellectual property rights, and international development cooperation. And the BRICS countries raised in recent years their potential at the countries that play a big role in international development assistance. And I think that it's something that we should explore in the future. The BRICS is a major player of IDA, of international development assistance, and in health, because we know that Brazil is one of the pioneers of breaking the barriers in terms of access to affordable and equitable access to medicine, to vaccines and drugs. So, and I think this is something that we should take on board. And please, Dr. Andrea de Mello Souza, please, floor is yours.
Many thanks, Chair. Dr. Smolensky. As you know, health has been a theme present in several of the BRICS academic forums, and has also been a theme of cooperation between BRICS governments. But obviously, and this was already pointed out, because of the current COVID pandemic, it has even gained more importance. Now, despite being a quintessential global public good, development cooperation in health during the pandemic has all but completely failed. And we have several instances of this failure. For example, countries have not been able to carry out coordination regarding the fight against COVID-19, let alone to collaborate in this fight. They have proceeded to close borders and to impose travel restrictions almost always unilaterally without consulting neighboring countries or other countries with which they maintain intense relationships. They have also adopted different standards and protocols for data collection. And this has happened even within the European Union, mind you. But the impact of this, obviously, is that there is an undermining of the possibility of carrying out comparisons and of monitoring the spread of the virus. We have also seen disputes between countries for diagnostic and serologic tests, for ventilators, for personal protective equipment, and for other medical equipment, to the point where there have been seizures of imports from China at stopovers in the United States and Europe. In Brazil, for instance, we have had, during the initial phases of the pandemic, to import materials from China via Middle East or Africa precisely to avoid these seizures. Now, I would argue that this failure in international cooperation largely reflects a failure in global health governance, and I will focus most of my presentation on such governance. We see that there, even before the pandemic, there has been a crisis in multilateralism. It has been growing, and again, it predates the outbreak of COVID-19, but it is manifested primarily in the recent suspension of World Health Organization funding by the United States, which was actually followed by the withdrawal of the United States from the organization. Now, you know that the US is the largest contributor to the WHO, so that this suspension of funding presumably has a significant impact in the work that is carried out by this institution. And the US has done so even while it provided an unprecedented and unparalleled $2 trillion stimulus package for its own national economy. So clearly there has been a politicization, not only of the World Health Organization, but of the pandemic itself. And this has happened in the ambit of a US-China geopolitical and technological dispute. But obviously, this leads to unfavorable results in terms of the policies adopted at the global level to fight the pandemic, because these policies should be guided primarily by technical considerations, not political ones. And there is obviously also a risk in our countries of unfavorable attitudes towards China due to this political narrative supported by the US. Now, despite this crisis of multilateralism in general, and in particular, the crisis in the health sector, the need for development cooperation and for greater cooperation at the multilateral level will only increase in the context of the pandemic. And this was already pointed out by the chair just before my talk began. This is because the developing world has a lower state capacity to respond to the pandemic, and therefore it will rely both on the cooperation of other more advanced countries, including the BRICS, and also on the WHO itself. For instance, nowadays, the data that is available indicates that Latin America is the most impacted region by the pandemic. And the impacts are not in terms of health, but it also has long-lasting and deep economic effects as well, as you know. And many of these countries will need some sort of assistance or guidance in addressing this health problem in the region. African countries are even in a more precarious situation, as some of them have actually no ventilators at all. A handful of ventilators are available in many other countries. And even though the incidence of the pandemic in Africa is still low, it may as well increase in the near future. And then we have the least developed countries, which still depend very much on the WHO for guidance on how to respond to COVID-19. So let me talk a little bit about the WHO. It has been severely criticized and actually even blamed for its failure during previous recent health emergencies, most notably the H1N1 pandemic, which had its outbreak in 2009, was not adequately addressed by the WHO, according to critics. And here, the problem was that the WHO overstated the gravity and seriousness of the pandemic, allegedly to favor producers of vaccines. And then we had the Ebola outbreak in 2014, primarily in West Africa. And here again, the WHO is seen as responding inadequately, but for the opposite reason. It is seen here as acting too late to address the outbreak. And then we have COVID-19 in 2019, late last year and the beginning of this year. The WHO is seen as responding, again, in an unsatisfactory manner for taking too long to alert other countries, too long to act, and to recognize the seriousness of the new coronavirus spread. Now, problems within the WHO obviously have a lot to do with inadequate funding or insufficient funding, with bureaucratic inefficiency, which actually seems to be a hallmark of many UN organizations, and as was already mentioned, its subjection to political influences. And we see at the same time an almost complete lack of governance reform in the WHO. Non-state actors have typically not been represented as they are in other institutions of global health governance. And precisely for this reason, we see the emergence of a lot of partnerships which deal with particular health issues under the umbrella of the WHO, such as UNAIDS, Rollback Malaria, Stop TB, and others. We also see a growing influence of private actors in global health governance, and particularly in WHO, which, as you know, is the main institution of global health governance. And here, the most noteworthy example is obviously the Gates Foundation. The Gates Foundation not only gives the opening speech of the World Health Assembly, which has symbolic importance, but even more importantly, it is a major donor of the WHO. It donates more than countries such as my own Brazil, and Argentina combined. And as a big donor, the Gates Foundation also has greater political influence, particularly in setting out the agenda of the WHO. Greater private influence in global health governance is also manifested in the emergence of public-private partnerships, PPPs. So we have a number of recent institutions, or at least more recent than the WHO, which are precisely institutions that bring together private and public actors that are multi-stakeholder institutions, if you will, such as the Global Fund and the Vaccine Alliance, known as Gavi. They're purportedly more efficient than the WHO. They're able to act more quickly and to respond more adequately to emergencies, such as the one that we're previously undergoing. And they're also seen as more legitimate because of being more inclusive and not just restricting their representation to governments. And for these reasons, they have attracted a lot more donors than actually even the WHO itself. It is noteworthy that the Global Fund, for instance, has a much larger resource base than the WHO, even though it only deals with 3 pandemics: tuberculosis, malaria, and HIV/AIDS. Now, to conclude this discussion of the WHO, it's important to note that for all its faults, it is still essential and cannot be replaced or done away with for several reasons. And no other health institution has as broad a membership base and mandate as the WHO. Secondly, as I've already mentioned, the least developed countries still depend largely on the WHO for guidance on how to respond to pandemics such as COVID-19. And then we have a positive development, which is the Health Emergencies Program within the WHO, which aims to help countries prepare for, prevent, respond, and recover from emergencies such as this one quickly. And it points to an expansion of the organization from being primarily a technical and normative organization to a fully operational one, which can, again, provide more effective responses in times of emergencies. It's also worth pointing out that the emergency of COVID-19 might actually represent an opportunity to reform and to implement changes that improve the WHO governance and operational response to health emergencies. My time is running out. I'd also like to mention briefly about the emergence of other institutions of global health governance. There have been several, and they oftentimes combine, as already mentioned, public and private actors. These tend to be multi-stakeholder institutions, and they have implemented several reforms which aim to be more inclusive and to allow for great engagement and participation of previously neglected stakeholders, such as developing countries, such as the BRICS. So, for instance, we have the International Council on Harmonization, which deals with the setting of standards for pharmaceuticals. We have Codex Alimentarius, which deals with food standards, but also very much related to health. They have also all favored greater participation of countries such as the BRICS. The ICH has granted the BRICS and other developing countries a membership eligibility, for instance, yet such reforms did not go far enough. There still persist many inequities in access to negotiation and decision-making processes, voting rights, veto rights, agenda setting, private sector membership and participation, and the distribution of information to these institutions still undermines the engagement and influence of the BRICS. In addition, several of the BRICS, if not all of them, also lack the human and financial resources required for leading working groups, for proposing new norms, standards, and regulations, and above all, for conducting technical and scientific studies which can support their negotiating positions in these institutions. Excuse me. Now, this is problematic because these norms and standards set in these institutions of global health governance, they're never neutral, as you know. They always have political, commercial, and distributive implications. And it's also noteworthy that the BRICS and other developed countries, they have different perspectives and different realities related to pharmaceuticals, for instance, or to health treatments, because they have different climates, ecosystems, agricultural technologies, modes of production. population eating habits, and drug stability and temperature also varies in tropical countries such as my own, such as Brazil, for instance. And these are oftentimes not adequately addressed in institutions such as the ICH, the International Council for Harmonization, which is still, by and large, dominated by the high-income countries of the North. And finally, one note on the governance of intellectual property, which, as we know, has had also significant impact in health, even though the TRIPS agreement, which is the main institution of intellectual property governance, when it was negotiated, health was not an issue. But subsequently, primarily with the spread of HIV/AIDS, we have seen that patent rights may restrict access to essential medicines such as antiretrovirals by making them more expensive, by creating monopolies which render drugs unaffordable to many of the populations and the governments of developing countries such as the BRICS. Now, the TRIPS and other intellectual property regimes, they were created primarily on behest of US companies. And in the current situation, the BRICS should be attentive to make sure that they do not limit access to vaccines and drugs. This has not been the case so far because actually we have seen a lot of cooperation in vaccine development. I mentioned that cooperation between governments has been largely a failure, but there is cooperation taking place at the transnational level between scientists and research institutions in a very intense manner. And the drugs that have been tried out so far are drugs that are already in the market, and therefore they're not eligible for patent protection. But this might change with the development of new vaccines and possibly even new drugs to treat the new disease. Intellectual property issues might arise. And the BRICS should cooperate to ensure that there is affordable and universal access to new vaccines and drugs to fight COVID-19. One final note is on tuberculosis. It is one area where intellectual property may become highly relevant as the few drugs that have been developed to treat this infection are protected by patent rights. And it is also one infection which has very high incidence in the BRICS. The BRICS present the largest incidence of TB, and not only that, but particularly of drug resistance TB. And then, and I'm actually now concluding, my apologies for going over time. India is known as the pharmacy of the world. It provides a lot of the drugs used in the developing world. China has been involved in the development of many of the current vaccines for fighting COVID-19. Russia also has its own vaccine, and Brazil and South Africa both have advanced manufacturing capabilities in the pharmaceutical sector and the health research sector. So BRICS cooperation in this regard is very promising. And I'll stop here. Many thanks, Chair.
Thank you, President Souza. You covered a range of issues. I wish we have more time to discuss all these areas, but I just want to underline that, of course, from our side, and we'll talk from the Russian perspective, that we should support WHO and we should, especially in this moment, the last 24 hours, it was a record, almost 600,000 new COVID-19 infections was registered, and WHO is under pressure to work with the world to help, as you mentioned, to give guidance, even not only to developing countries, but even to developed countries, because WHO accumulates a lot of information, disseminates this information. And for us, the fragmentations that you mentioned, fragmentations between different actors that want to play a global coordinating role or in the health, in the global health, we think it's for this time, especially for today, it plays negative role. From our side, we think we should strengthen WHO at this time. We think we should support it. And even now, when, I mean, WHO decided, you know, this resolution 73.1, WHO decided to and it was pushed to give evaluation of WHO response, how WHO responded, and the two teams were created, two committees were created. But now, when the fire is on, we try to evaluate how WHO responded. It's still responding, and I think what is important to keep this in mind, that we cannot evaluate what is still not over, and we should be a little bit more careful with this, because we now dilute the strengths of WHO by forcing it to self-evaluation, etc. So, and another important, I would like to underline that you mentioned very important things about the area of cooperation of BRICS countries in the R&D capacity. I think it's very important. Thank you. You mentioned that Russia has vaccine, and Russia registered 2 vaccines. One was developed by Ministry of Health, another was developed by institution that I represent. It's Russian Public Health Agency, Rospodrepnadzor, and it's a vaccine based on peptide technology. So I think there's something that we should build cooperation on, to have this multilateral cooperation on vaccine trials as well. So I stop here just because we have a lot of speakers in front of us, for more speakers. And next I would like to give the floor to Mr. Oman Kurian, Senior Fellow, Head of Health Initiative in Observer Research Foundation of India. I'd just like to mention that Oman was trained in economics and community health in Jawaharlal Nehru University in New Delhi. And he also worked on the issues of healthcare, nutrition, gender, and poverty with various organizations, well-known organizations like Oxfam India, Action Aid India, Center for Inquiry into Health, and allied themes, just named a few of them. So please, floor is yours.
Can you hear me clearly? Yes. Thank you. Thank you, Dr. Smolensky, for this opportunity. Good afternoon, ladies and gentlemen. These are very, very difficult times, and over the past months, a substantial proportion of global COVID cases and deaths have been in BRICS countries, as you can see in front of you. Other than Russia, where there is a worrying increase in cases and deaths as we speak, the initial peak seems to have passed in South Africa, India, Brazil, and China, of course. From the beginning, if you look at the testing strategies, Russia and China have been testing very aggressively, but other members of BRICS have had a lot of catching up to do. However, barring perhaps Russia and China again, for every non-COVID case, there may be many more invisible cases, given the limitations in testing. There is bound to be a subterranean spread, and over time, in India's situation, this has improved, but it is still substantial. In India, for every recorded COVID case, there used to be 100 undiagnosed COVID cases in the beginning. Now, the testing strategy has accelerated, but still it is about 20 to 30 undiagnosed cases for every known cases in India. So given the surge, given the kind of surge that we are seeing in Europe, for example, and Russia also, these countries now who have reached a plateau will have to be on high alert. It was, of course, expected that proactive measures to slow down the spread of disease would delay the spread and give the health systems time to prepare. But given the low healthcare delivery capacity in countries like India, of course, and the immense costs in terms of disruption of treatment of non-COVID conditions, the real costs and benefits of harsh lockdowns are yet to be analyzed in countries like India. There have been cities in India where health system itself was overwhelmed. There have been cities and smaller towns where the private sector shut down because the health workers were refusing to work. So in a way, COVID-19 amplifies existing health system bottlenecks in many countries. We have healthcare personnel shortages, we have medical equipment shortages, we have inadequate access to medicine, we have inadequate health system infrastructure. To start with, India, for example, the government health care delivery system had around 17,000 to 25,000 ventilators in the country, servicing around 1.38 billion people. Even if you include the private sector, which had about the same number of ventilators, we were still very short in the beginning. And over the last few months, this capacity has been doubled. Around 50,000 ventilators have been added, but many towns, many cities, and many states will not be able to withstand a surge like the one that we are seeing in Europe. In India's case, thankfully, the initial phase of the pandemic focused on urban areas. Most of the cases and deaths were happening there. So shortages were not very visible because the private sector is concentrated in these cities, these urban areas. Talking about high-risk populations, BRICS countries represent about 40% of the world population, while only 23% of the world GDP. The group, perhaps barring Russia, has a relatively young population. For example, India has only 6% of over 65-year population. And just like economically diverse population, the demographic profile and the epidemiological profile across BRICS nations are highly varied. If you talk about India's case, even if the proportion of the high risk elderly population is low, the absolute numbers are breathtaking. More than 100 million people reside in India aged over 60 years. The number of cases of COPD every year in India is 55 million. We have 50 million people living with diabetes, around 54 million living in cardiovascular disease. Every year, more than a million new cancer cases appear in India. Around 1,500 people die of cancer every day, and about the same number die of TB every day in India. As you can see, most of the BRICS countries have a younger population than the world average, but still, because the countries are large, the absolute numbers are very high, and the numbers of high risk population which who are at danger of an adverse outcome with COVID are very high, and hence these countries will have to be on a permanent alert for the medium and short run. Is COVID the only health system challenge for BRICS now? Indeed, as I said, the situation is grave, but the countermeasures have caused health systems capacity to treat non-COVID conditions, which are as grave in countries like India. With time, overall, in the world, we had seen over the last few decades a shift from communicable diseases to non-communicable diseases. Communicable diseases, at least in the developed countries, were seen to be solved with vaccine and economic development. The citizens enjoyed protection linked to, in a way, their income levels through expensive treatment often or vaccination. So NCDs were seen as conditions that can be managed with care and self-discipline. So there was a certain tolerance to the inevitability of NCDs, but a deadly disease which comes along unexpectedly, like COVID, changes everything. Since it connects these two conditions, categories of conditions, NCDs and communicable diseases, and amplifies the risk. So if you look at the burden of diseases in BRICS countries, predominantly non-communicable diseases, but in countries like India and South Africa, communicable diseases are still a huge burden. So, as I said, COVID is amplifying inequality within the system. It is accentuating the fault lines within the system, healthcare personnel. So these the following bottlenecks will need to be overcome in the medium run. It is a common challenge for BRICS countries and the world. Healthcare personnel shortages, medical equipment shortages, medical infrastructure shortages, access to inadequate access to medicines, vaccine access, and also neglected diseases. Talking about COVID and how we fight COVID, of the 24 vaccine candidates that have reached phase 2 trials, 12 are from BRICS countries. In the immediate future, assuming we have an effective and secure vaccine sometime end of this year or maybe early next year, there are bound to be global shortages in the medium run. Once we have a few good vaccines, global vaccine supply chains may need to be streamlined so that there is no idle capacity, there are no inefficiencies in the supply chain. The governments and private sector may have to work together so that patent protection or geopolitical considerations do not affect access to vaccines or medicines. But BRICS countries, as importers and exporters of health-related products, have a disproportionately lower visibility, perhaps barring China's case to an extent. Yes. This is the international trade in health-related products. BRICS countries' share of main imports 2018, which is the latest available year. If you look at China, China has 11%, India 2.1%, Russia and Brazil 2%, and South Africa under 1%. So the negotiation, these are of course, and similarly for exports, barring China and to a certain extent India in formulations, the negotiation power of BRICS as single countries is limited. Hence, I think there is a case for coordinated action within global governance structures. These are, of course, dollar figures. If you consider volumes, the picture changes. But in global negotiations, it's not the volume, but the dollar equivalent that matters. Again, there is scope for BRICS to work together on universal health coverage and the achievement of SDGs. As you can see in the table, the picture is diverse. There is varied progress towards universal health coverage in the BRICS countries. So there is immense scope for cross-learning, lessons from the countries who are doing well in, say, regulation and risk pooling, lessons coming from these countries, strengthening and enabling the other countries to perform better. So comparative studies and platforms for cross-learning will have to be coordinated. Again, coordinated efforts of global forums like the recent proposal of India and South Africa to the WTO for easing intellectual property rules for COVID-19 and presenting an alternative vision for health governance is important going forward in the medium and long run. There is a need for BRICS countries to act as a bloc, and also organizing shared training platforms for the health workforce that can be a priority in such testing times. BRICS should host policy workshops and exchange programs particularly for health workers from these countries. And of course, like a previous speaker shared in detail, use of information technology. It can be revolutionary in the healthcare sector, and it can, of course, help many countries leapfrog their existing bottlenecks, and also enhancing regulatory capacity in situations like India. And promotion of collaborative research and development in innovative medical products is an important issue. And fighting premature mortality, in some countries it will be the non-communicable diseases. In some countries it will be infectious diseases, but it remains a common priority. In this context, strengthening WHO's framework convention on tobacco control can be a common goal across BRICS, including promotion of economically sustainable alternatives to the farming of tobacco, which is a major livelihood issue in India. Towards these goals, collective initiatives funded by the new development bank can perhaps be a way forward. When we think about new initiatives, perhaps assessing the strengths and weaknesses of existing collaborative platforms like BRICS Tuberculosis Research Network, established 3 years ago, or BRICS Council of Exercise and Sports Science, founded in 2015, can perhaps add value. Thank you so much. I'll stop here. I'll be happy to take this discussion forward at the end. Thank you.
Thank you, Roman. And you just confirmed that BRICS cooperation in the health area should go far beyond acute problem of emerging situation that we have right now, and you covered perfectly all other areas that areas of concern and areas of cooperation. So with this, I would like to give the floor to Dr. Li Donzi, Director of Division of Infectious Disease Control of China CDC. But before I give you a floor, Dr. Donzi, I just want to thank China CDC especially, and what was done in the beginning of the pandemic information that we got, for example, in Russia on the 31st of December, helped us to strengthen the control on the border. And then you published promptly the genetic sequence of the virus, and it was helpful to develop the test system, and just using this information in the gene bank. And our center vector developed it in 1 week after you published the sequence. And also I would like to thank our Chinese colleagues for giving an opportunity for Russian delegation to visit Beijing in the beginning of February. It was the only one delegation that were allowed to visit China in this time, and to discuss the situation, to exchange information, to check out test systems. And we visited CDC, and we're working in the lab together and to make comparative diagnostic test to test our test systems. So thank you for this openness and readiness to share information with the world. And with this, I give you a floor, Dr. Zanzi, please.
Okay. Could you see my presentation? Hello, could you hear me?
Yes, we can hear you. We see your presentation. Everything is fine.
Okay, great. Thank you, chairman of this section, and good evening in Beijing time. Yeah, good evening, dear friends from BRICS countries. I feel so honored to have the opportunity to join this section to discuss the health topic related to global health and COVID-19. In this 10 minutes, I'd like to briefly share the COVID-19 response in China and to emphasize the global cooperation, the importance of cooperation. So firstly, as we all know, the COVID-19 has been an unprecedented pandemic. It's actually compared to the past several pandemic related to influenza. We could see you could see the right figure. Actually, the transmission capacity and the clinic severity. The COVID-19 is very similar to the 1918 H1N1 flu pandemic. So you can say it's very severe than the several other pandemics happened in 2009 and as well as in 1940, 1957, 1968, etc. We need to be aware that you can see in the just 100 ago, the 1980 pandemic, globally we have lost so many huge amount of lives. So that's why we need to highlight the severity of this disease. It's not actually maybe currently we could reach the common awareness about the disease, but on the early stage, maybe some people regard it as the big flu, but we could see it's not a flu; it's more severe than flu. So the academic global situation you could see since the March of this year, it's rapidly spreading globally in the different regions. You can see currently more than nearly each country, I think, have been affected by this disease, and many people have been. We have found many people, but there are still many cases have not been detected and recorded. Even though there are also more than 40 million cases have been found. So it's we could see the incidence trend. It's still rapidly expanding and transmission globally. So many people worry about the coming winter season. Actually, we also worry about it. It will bring, I think, it will bring more severe challenging, bigger challenge in the coming winter season, especially in the I think northern hemisphere. Will not only for the COVID-19 but as well as for the other common respiratory infectious disease like influenza, seasonal influenza, and well as RSV, adenovirus, etc. It will bring greater load for our medical health care systems. So about the COVID-19 situation in China, actually, this disease is first be found in China, in Wuhan city, the middle city of China. You could see the small graph, at the early stage increased very sharply. The highest amount of cases per day is nearly reach 4,000 cases. So actually, at that stage, the amount of the case nearly overload the local medical system. But we take rapid very strong response measures. I will introduce in the following slides. But it also nearly 2 months, nearly within 2 months, we have successful contain the epidemic center in Wuhan city. You could see the blue bar shows the local confirmed case. And since we have successful contained the virus transmission since the early March, we still have some sporadic or small size outbreak of local case. You could see the blue bar, but we are also facing another challenge is the imported case, overseas imported case. You could see the orange bars. Anyway, since the March months in China, there are very low level incidents in China. We believe this data because we have built up the very sensitive and robust surveillance disease system in China. You could see the right graph since the March in this year. All the provinces in China, nearly all the provinces in China have been recorded have cases at a different level. The border province like Xinjiang, and the Guangdong province and Shanghai will the importation the harbor will facing the greater challenge of the cases. So currently our country goal is to keep the containment status. Currently since the beginning of the epidemic of COVID-19 to now, there are still no effective vaccine or effective medicines, antiviral medicines for COVID-19. So we still use the very, very traditional public measures. Actually, these measures have been recommended by WHO to in the past several years to deal with the potential influenza pandemic. From our experience, even it's also I think maybe it's also a new public health practice. Even we have no vaccine or medicines, effective medicines, use the traditional public health measures. We still could contain the emerging infectious diseases at very early stage. Actually, like SARS, as you may still remember, and the SARS in 2003, we still have no effective vaccine and medicines. But we need to implement each sector of the measures thoroughly, rapidly, and with very strong supportive resources. I have no time to introduce one by one, but this all the section is have the specific purpose to interrupt the virus transmission. So actually, the most important measure, the core measures from our side, we think is the active case finding and management is the most important work. We need to test each suspected case and to isolate and management each case, each confirmed case, as well as to trace and quarantine each close contacts. It's really not so easy. I know not so easy to implement all these measures, but we need to mobilize, motivate all the resources possible, all the possible resources to focus on these core measures. Besides the early detect and reporting and early isolation, the early treatment is also important to reduce the clinical outcome of the diseases. So it's an example for how we motivate the supportive resources to deal with this COVID-19. You could see several numbers. In Wuhan City, the epicenter of the early stage, you could see we rapidly increase the patient beds in a very short time from 4,000 beds to 23,000 beds. We also built 3, you could say, makeshift hospitals like this in the stadium and in some greater bigger settings to simple but effective to isolate the mild cases or even the some close contacts. In China, at the early stage, the mild cases are not permitted to stay at home because it's and you know the mild and the asymptomatic cases have the transmission capacity, have the infectivity. So that's why we expanded the quarantine beds in a short time. And whereas you know the testing capacity is also very the essential capacity for to detect, to find the cases. That's only several numbers for us. So another experience I think is when the epidemic occurs in Wuhan City, many other medical care personnel, doctors, have been dispatched from many other cities, other provinces to join to go to the field of the Wuhan City to make many great help. So to rapidly increase the amount of the healthcare workers in the epidemic area. So currently, we China have in a new normal. We say.
Sorry, can you just make sure that we have 15 minutes left and just 2 presenters more? Just can I? Ask
Okay. Sorry. I will finish in 2 minutes. Okay, thank you. So actually, now we need to balance the COVID-19 response and the social development. So we developed the precise response strategy. Like you can see, we slowly increase the amount of over international air flights, and we open some public facilities as well as the school students also be open. Under international cooperation, yes, we also think we need to support the international leadership like you and WHO. very good platform for multi-sectional cooperation. We also dispatched some expert team to help other work together in other countries. On the vaccine, as the expert from India mentioned, in China we currently have several different vaccine under development and use currently 5 different technical routes, and we also have 4 kinds of vaccine moving into the phase 3 clinical trial. It's hard to say the accurate time when it will be finished the phase 3, but we hope it will be maybe in the next 3 months. I think we hope so. And also some new kind of vaccines under development on stage 1 and stage 2. Yeah, just in this month, on 9th October, China have declared to join the COVAX, global COVAX, supported by WHO, Gavi, and CPI. Yes, we also active join to build up the new and share in the public goods, and we also think COVID-19 vaccine is not a common vaccine. It's a very emergency and unusual vaccine. We hope it could be a common good and build a new mechanism to share with it. Okay, that's briefly introduction. Yeah, if you have time, we could have further discussion. Okay, thank you.
Thank you, Dr. Zanghi. And with this, I just give floor to Dr. Aquina Tulare, the only lady in our gender imbalanced panel today. So I know that Dr. Tulare represents the Ministry of Health and the National in the National Joint Operation Intelligence Center of the National COVID-19 Command Council of South Africa, and has extensive experience in public health and other issues. Please, floor is yours. I know that it's unfair to ask later speakers to speed up, but sorry about this. I will ask you and next speaker also to keep timing, but to have a little round of questions after all speakers. Thank you.
Thank you very much. I hope you can hear me. Thank you. Yeah. So let me just thank everyone. Let me thank our friends in Russia who have organized this meeting. I first want to start by indicating that at the beginning of the year, WHO did take some initiative and leadership to start identifying potential challenges that will be facing the world in 2020. And amongst those were in terms of communicable diseases, issues around social determinants of health, antimicrobial resistance, issues on climate change, issues around the non-communicable diseases and communicable diseases, challenges with human resources, medicines availability, and universal health coverage and health technology. I've put COVID at the center of this slide because if you look at all these areas that have been identified by the WHO, they in one way or the other influence how COVID progresses or how we are able to manage COVID-19 itself. The most current discussions are around availability of vaccines, but we know that if you look at how COVID has evolved, poorer people are affected more by COVID, therefore social determinants have an impact. Health systems that are weak are not able to manage COVID effectively, hence the issue of universal health coverage. Availability of health technology and equipment, we have had in previous presentations issues around availability of ventilators, the technology itself, availability of other medicines has been a key factor. So without being a champion of WHO, I want to say that the thinking has been there within WHO to anticipate what could be a potential challenge. And this was done before COVID became our Franco lingo in terms of how we are operating today. I also want to say that BRICS had preempted some of the challenges that we are facing. And if you look at the Ministers of Health meeting that took place last year in Brazil, some of the issues that were discussed during that meeting, it's firstly around the political declaration of the UN meeting on universal health coverage, where we had committed to move together to build a healthier world. We had noted the re-emergence of measles and recognized the urgency of improving global vaccination programs. Also, in terms of improving quality, access to safe, quality, effective, and affordable essential medicines, BRICS countries had already debated and discussed the need to focus on this in the upcoming years. The issues around TRIPS were discussed and they were prioritized as one of the areas that we need to be looking at. And also in terms of supporting efforts of member states' capacity to deal with health emergencies. And whether, our declarations become something that we are practicing, it's something that we need to be reviewing and looking at on an ongoing basis to make sure that as we pass these declarations, we are able to cooperate and come up with robust strategies that are going to be helping us, especially if we look at some of the health emergencies. And now I just want to indicate that from our understanding, these global health challenges refer to the inability to protect the health of persons or societies globally, and they result in levels of political and social incoherence and collective vulnerabilities to global public health events, and they can spread across borders. We have seen, as with COVID, that it has resulted in weaknesses in national public health systems being accentuated. We have seen a situation where there's disruption or undermining of multilateralism and systems of global governance. And my co-panelists have already elucidated this quite extensively. We have seen mass production shut down and disruptions of global supply chains. And we have seen the concepts of vaccine nationalism. But if we look at these, we know that we are now looking at this either in terms of national security challenges, biosecurity, or human security. And this is how the debates have evolved in recent times. I just want also to indicate that the pandemic has exposed some of the illegitimate efforts by some of the dominant countries in the global north, and picking specifically on how the USA has managed to conduct itself using unilateral mechanisms, undermining the UN Charter, the UN Security Council mechanisms, and contrary to international law on countries such as China, Russia, Iran, Cuba, Venezuela, where we expected that with this emergency, we would be working together and not contravening some of the global frameworks that we are working under. But the pandemic has also revealed the lack of strong vision that unites developing countries around a shared international agenda. And this has been marked, of course, by the undermining of multilateral developmental global governance systems, and also the issue of vaccine nationalism. We are not saying that being nationalistic is a problem. I think, you have to have an element of inward looking, but also we have to look at the global public good and the issue of solidarity. We know that the vaccine nationalism in its raw state poses a threat to availability of vaccines for future vaccine supply. I just want to give some examples that the US, for example, at some stage had amassed, a way of securing entire supply chains of vaccines themselves, of drugs that were identified to have the potential of shortening hospital stays. And they had ensured that, they secure this for their own interests only. Gavi also at some stage had created a facility for advanced purchasing of pharmaceutical agents and the vaccine. And we know that the COVAX facility now that China had indicated that they had signed for is an effort by the global community to try and improve access, but you have to commit upfront and you have to put up some down payment to ensure that your population has got access to the vaccine. But, and we know that at some stage, for example, with a case like South Africa, we had wanted to secure vaccines for 20% of the population, prioritizing the populations that may require vaccines more urgently, such as health workers, the aged populations, and those that are in the front line. But with all the negotiations, our requirements have been reduced to less than 10%. And in actual fact, I would want to say that to 3% of the population that we had identified. So we may have some ambitions, but it depends on your strength in the bigger global scale. And I just want to indicate that in all this, I think, the WHO has shown some leadership in establishing this COVAX facility and the access to COVID-19 tools, the ACT mechanism. And I know that we have been quite critical in some instances of how WHO has conducted itself. But from a South African perspective, we have received a lot of support from the WHO. They have even assisted us in deploying technical support to help the country with some of the epidemiological analytical work that is required when we are looking at how the epidemic is evolving. I just want to also highlight some areas. We must not be too harsh on ourselves and say that BRICS has not been very preemptive in how we are cooperating. We know that the New Development Bank has repurposed its lending program, and it has provided a 10 billion emergency assistance program dispersed to the various countries in various proportions. And I also want to highlight some of the areas of cooperation that have been seen around this period of crisis. China-Africa Summit on solidarity against COVID. We have seen China also providing a large number of medical supplies to fellow BRICS countries, and also facilitated purchase of such supplies through commercial channels. India has taken various decisive steps in providing pharmaceutical assistance to nearly 85 countries, including many countries in Africa on a grant basis. And of course, under the chairship of Russia, there have been very, very intense discussions around how the virus could be ended. And we know that there's a lot of work that is taking place around some of the institutions in Russia. But what is of concern is that as we are cooperating, our cooperation tends not to be so effective, because I would have expected that if, for example, Russia is producing the vaccine, we as members of the BRICS should have taken advantage of that and leverage that to ensure that our populations, especially our vulnerable populations, are protected. But I guess it's still work in progress, and we can still improve on this cooperation further. Let me end my presentation by just highlighting some of the areas that I think we could use for cooperation. The first one is around cooperation and information sharing in disease prevention, control, treatment of patients, and any other relevant research. I would want to just highlight also, as I'm concluding, that China and Russia were very, very supportive to South Africa as we were grappling with how the epidemic was evolving. And on various platforms, did they provide exchanges, academic, intellectual, research information around their experiences? And I think that is very, very important and critical. But also that as BRICS, we should strengthen the global coordination on research and development, on mass manufacturing and equitable distribution of vaccines and any other supplies, and to ensure that they are available to mitigate the emerging nationalism that we have seen. We must do everything possible to minimize the impact of pandemic on the world economy, work together to ensure that we support each other in strengthening our economies, as the impact of COVID has resulted in a catastrophe in terms of our economies. And we must also stand firm behind the multilateral system through a UN-centered system, and we must sustain coordination in the UN, but also in G20, which is an emerging player, and other multilateral frameworks. We need to support the WHO as it grapples with how the epidemic is evolving, but also in terms of future global challenges that we may be facing. This is my submission. I thank you.
Thank you, Dr. Pilar, and especially thanks for naming the concrete areas for BRICS further action. This is what I want to each speaker to mention one of the further areas for cooperation, or one of the commitment for leaders at the end of the session as the last speaker. So please think, each of you, please think one. Select one what you think should be most important from your point of view. And with this, I'll give the floor. I was said that we can sacrifice lunch for discussion, so I think it's a good exchange for us here. I'll give the floor to Professor Eldar Akhtamazyan, who is the associate professor in the Moscow State Institute of International Affairs. He has almost 40 years experience in teaching in the university, in the institution, one of the famous institute in Russia and in the world. So I will not say something special about the Professor Akhtamazyan, because he will, I think, we will see from his presentation. But all I want to say is he is specialization is non-proliferation, as I know. Yeah. So I think his presentation should be an interesting one. So please, Eldar Abdukhalovich. Yes, you can press it. Yeah.
Do you hear me? Quite so. Thanks, the colleagues. I've listened with great interest to all of those presentations made, and a lot of thought-provoking ideas I've heard today, so thank you a lot for that. I feel myself in the role of the big bad wolf who deprives those present of the necessary lunch hour, but I'll try to make the most of the time that you will sacrifice for me. To begin with, I am not a doctor, I'm sorry, because the majority of those who were speaking today are either practicing doctors or scientists in the field who do a lot of good for humankind. I am doing my job as a specialist in weapons of mass destruction and their non-proliferation and prohibition. So I have a pretty different viewpoint on many of the subjects which were touched today. I'll show you, for the sake of brevity, I'll show you the central points I would like to speak on today. But having no time for questions and answers, which I also plan to utilize, I'll just comment on some of the points you see here. My first question is quite direct. Humanity has lost over 1,100,000 people in practically no time. That is war. That is no pandemic as we expected it to unravel, and Many of us expected it to end by May the 10th. I mean, the chief of the bank I keep my money in, German Gref, he promised that everything would be over by May the 10th. I'm sorry for my banker. I should think about changing probably the, because that prophecy is one of the, well, okay, you understand me. Then everyone expected it to be over by summer. By the end of the summer, we were all ready to breathe freely and to cooperate and to mix with people without any masks on our faces. Again, a flaw. What forecasts do I hear now? More and more often, the preceding pandemic is of the scale is mentioned. Dr. Souza, I believe, mentioned it today. H1N1, the so-called Spanish flu. And as far as I remember, from 60 to 100 million lives were lost in that pandemic. That's not the perspective which is encouraging for those present and for the humanity at large. So I would begin my statement with point number 1 you see on that menu that I've prepared. Is it a pandemic, a natural pandemic, or is it a biological warfare? So I deal with a subject usually within my courses, my university courses, telling my students about the dams, so to say, which were constructed by humankind against the possibility of losing so many lives. And I would like to call your attention to the 2 documents which exist already in international relations, in international law. The 1925 protocol prohibiting the use of biological weapons and of relating matter, and the 1972 Biological Weapons Convention, the document which in my student times, it's an open secret how old I am, we celebrated when it was signed and brought into effect. I remember the enthusiasm we felt. We wouldn't have to learn at least 1 chapter out of the translation textbook. What happened to these documents? They are in force, and I'd like to draw your attention that on the eve of this century, the countries which signed the documents held a review conference. In 1996, the review conference of the Biological Weapons Convention critically reviewed the document and discovered that there are not enough measures of verification, things which seem logical for any arms controller who deals with any field, with any subject in the field. So a decision was made to convene a special conference. It based its work on the ad hoc committee acting even from 1994, but we organized a conference on the eve of the 21st century to prevent the things we are viewing today. As you understand, 200 countries, well, about 200, about, I believe, 183 countries, to the best of my knowledge, are members of the Biological Weapons Convention. Each of them had its own position, how to verify the convention in the future. We managed to find a compromise. We spent 5 years of the most arduous negotiations, but we did the job. The protocol was ready for signature. And I would like to remind you that in March 2001, one of the participating countries participating in this discussion, the United States of America, told the world that no signing of the protocol is possible in the foreseeable future. Bush, the son or the junior, or W. Bush, as he's known in the United States of America, W. Bush, his administration blocked the road to, I believe, what was quite logical system of verifying the complete ban on biological, or the system of inspections was foreseen. The creation of a special checking organization was foreseen. We would have far fewer questions today if only the document was open for signature and brought into effect. So I have a political suggestion for our BRICS conference to recommend to put this protocol on the table again. And let those states who support creating the verification mechanism to the Biological Weapons Convention sign it. I don't see any logical obstacle on proposing that, at least. I believe that BRICS may play a vital role in reviving the idea of blocking the consequences which we all face now and can foresee even worse consequences. Point number 2 on my list, or on my menu of my list of main points: technological breakthroughs. They began approximately in 1997 with recurring interest in biological warfare in the United States of America. That year, in 1997, a woman who died as a result of the Spanish flu, H1N1, as we know it, was exhumed from permafrost in Alaska for the sake of reproducing the virus. As easy as that. And since 1997, the world was in abeyance. At least the experts who followed this decision. Why? Why do we need it? Naturally, to fight the possible recurrence of in 1997. By 2002, the procedure was complete. The virus was there, back again, in the laboratories. In 2002, another laboratory in the United States of America have created from scratch, synthetically, the virus of polio disease that the world was rid of. We were proud, all the medical personnel was celebrating the event. The last person who was ill with polio in the United States was cured in 1979, as far as I remember. Again, the reconstruction of the virus, and it was reconstructed from scratch. Very interesting. There are different types of infections, as the most of those professionals know well. And we were well protected from getting infected by our pets, from the animals, because there were natural barriers that the nature constructed within our ancestors. We were well prepared. So from 2002, we hear for the first time. I accumulated all this knowledge, never knowing what for, but as a scientist, as an expert, I accumulated the data as it came up. A zoonose, I don't know, in English it's zoonose, I believe. New type of infections appeared on the stage. Why? Now animals become dangerous. Your cat may be your killer. Your dog, your raccoon, your pangolin, your civetta, as far as I remember the recent threats mentioned. Awful. In the year 2002, a special program was started in the United States of America. PREDICT project. So put down the name. I'll stop here on this subject, because if you are interested, just Google it. We are now living in a very information-imbued world. So check PREDICT. Project 2002. It lasted, I believe, for a decade at least. As a result, 2,000 zoonose viruses were collected within this project, under this umbrella. We have seen the result of one virus in the world. SARS-CoV-2, something which provokes COVID-19, the epidemic, the pandemic. If there are 2,000 more, I'll never be rid from this mask in my life. This is, I believe, the starting point for our analysis. In 2017, the third point of my short menu, I heard of the problem for the first time. We had a big conference at the Diplomatic Academy in Moscow. Peer Center was one of the organizers. I was invited. The new challenges facing humanity. As a specialist in non-proliferation, I expected a large share of the conference to be dedicated to weapons of mass destruction. They told me from the outset, forget about your things of the past. 2 new threats are facing humanity. And I'll confess, I concentrated my attention on the second threat, not on the first one, which was mentioned. The second threat seemed more important to me, the threat to our cybersecurity. I believe that it is much more vital, those attacks on cyber systems with big industrial objects. They occur approximately once every month. I expected a tragedy in the coming years. I was mistaken. And the second threat, mentioned in September 2017, was the threat involving the changes that we make with the genes of a human being, of other animals, of viruses. Why? At the time, I never gave it much thought. I just began collecting dossier, or continued collecting my dossier on the biological weapons. Then comes December. I'm afraid then the thing which preceded was October 2017. President Putin is addressing a body dealing with civil society and human rights. All of a sudden I hear, and do you know, he says to his officials, do you know that the West is rapidly accumulating the biological material of ethnic groups living in Russia? I was astounded at the time. I added a page to my dossier, but I've never expected COVID-19 scale of what happened. The shock of 2019, 2020 came practically unexpected for the most of us here. But it was preceded by, I don't know, that's a back translation from Russian, Event 201. A simulation game of the future pandemic, which was organized by the now well-known Hopkins University. Impossible. On the eve of this tragic pandemic, they were simulating it. They've expected millions of dead. They've expected the recession in the world economy we're facing now. Unbelievable. So I have to stop here because I believe my Chinese colleague did a very good job at showing the Chinese successes in curbing pandemia, which I believe is a good lesson for all of us members of the BRICS, and we should draw our lessons from the Chinese experience, very good experience in curbing the pandemic. And I expected some questions to be asked, but I'm afraid that I am really a big bad wolf robbing you of lunch, and I'll stop here. Thank you for your attention.
Thank you, Professor. Thank you for your opinion. And I know that we are far beyond the schedule of our discussion, but just would like to thank all our participating panelists. And just in one sentence, I just would like from you to hear what is the area or actions that BRICS should do in the midterm perspective to increase its role in the in resolving global health issues, global health problems. Please, I will start with the maybe with Dr. Jinju. Can you say what do you think for BRICS is most important area for cooperation right now? One action to do. Can you hear us, Doctor? Okay, Dr. De Mello Souza, can you give your proposal just in one sentence?
Sure. Thank you, Chair. I would say in the short term, definitely the proposal would be the development and distribution of vaccines to fight COVID-19.
Thank you. Thank you. One, can you?
Yeah, I think presenting an alternative vision of health governance to the world will be an important aspect.
Thank you. Dr. Tulare?
I think we must strengthen our intra-BRICS cooperation and support multilateralism.
Okay. And Dr. Dingju? Dangji?
We can show Sweden.
I just finally emphasize the vaccine. Many experts mention it. We hopefully we have sure the successful have the effective and safe vaccine. Okay, hopefully. Thank you.
Thank you, colleagues. I don't know if one colleague from here want to add something. No. Many thanks one more time. We are closing to the. I mean, we go. Summit will be Victoria, 17th of November. We have our summit of leaders. It will be in, as a video conference format, I believe. And I wish you all. I know public health and science is now in the front line. I wish you all to have. I wish you all success in this turbulent time, and I think we are still in the middle of the crisis, and but we know much more than we knew 10 months ago. And I think this knowledge and our cooperation between countries will help us to. I will finish with what I started to save more lives and to protect our populations. And I wish that BRICS will play a good role in this, because we have all potential, and our collective potential is much bigger than our national potential if we will do it alone. And I support all the areas you mentioned, and especially global health governance and exchange and and access to treatments and vaccines and inter-BRICS cooperation. I think this is areas where our leaders can commit to concrete actions, and we will try to move in these directions and ask them to do so. So thank you for your input and your time, and I wish you very success. Thank you all.
Good morning, good day, good evening for everybody, wherever you are. Warm greetings from Moscow, and welcome to the BRICS session devoted to one of the most important, challenging, and thrilling question of modernity, the artificial intelligence. So, devoted to different technical and regulatory issues. So, let me first of all say kind thanks to our organizers, because our today roundtable section is balanced around at least three levels, three areas. First of all, of course, there is a clear representation of all BRICS nations. Secondly, we have here both specialists in humanitarian science, that's international relations, security issues, and so on, and as well as technical specialists as far as can grasp from the program. And finally, which is definitely not the least and very important considering the topics that we are going to discuss, we are very gender balanced, and this is important in my eyes. So once again, thanks for the organizers, and hello, welcome to the session. So let me say a couple of words related to the some technical issues. So we have 10 minutes for each reports. If you will need some 2 or 3 more, that's no problem, but well, I'll make you a sign when you will be out of time. So then we will have the discussants, which will say the important ideas concerning the topics we're discussing here and now. And finally, we'll try to leave some time for the questions from the online audience. So the question that we're discussing here today is one of the most, as I put it earlier, challenging for our societies, our economies, and even for our political and cultural life. So artificial intelligence and digital technologies are changing us, and I guess quarantine and COVID-19 pandemic shows it more than ever. So we have a great push for the development of digital technologies, and it is not only about the technologies per se, it's also about the regulations, it's also about the ethics, which is the new realm of the digital development globally. This is also about the cooperation and networking between the experts, the technological community of our nations and globally, and definitely about the decision makers who should create a more favorable, trustworthy, and robust environment for the digital development of our countries, as well as, of course, inclusive. So we have a number of questions that were released earlier by the Academic Forum, and let me give the floor for the first report, Dr. Anna Abramova, who is head of Department of Digital Economy and Artificial Intelligence of ADV Group companies in GIMO University. Anna, the floor is yours. Welcome.
Thank you so much. Thank you for the invitation and the chance to share the ideas with colleagues on AI development and further tracks for collaboration within BRICS. I'm sharing the presentation. Is it okay?
Thank you.
Thank you. So AI, especially during the pandemic, has become one of the central tracks for further development within digital economy for the majority of the countries that now are working hard on the improvement of the capacities in this field, and also with regard to national security. So according to one of the largest consulting companies in ICTs, Gartner, by the end of the year 75% of the enterprises will shift from piloting to using artificial intelligence. And this is raising a lot of concerns and need to find the balance between trust, security, and use of AI technologies. And of course, facing all these challenges, we have to involve all the actors for proper resolution of the issues connected with governance at all the levels. Besides having these very fast development of AI technologies, we still see that digital divide exists, and it also reduces the capabilities for AI system development and progressive adoption in different countries and different regions, even in those that are advanced in AI technologies development. And the other issue and concern, it is the deficit of the specialists in the field, especially those in AI and data science, that brings additional challenges and opportunities, of course, for the labor market and our systems of education. AI sector is actively development in Russia, and it is one of the main priorities for the digital economy development here in the country. And several significant steps have been introduced during the past 2 years in order to somehow give the additional push and to shape this trajectory for the development. First, the essential one, it is the national strategy for artificial intelligence. It is midterm strategy till the year 2030. The key issues that are raised in the national strategy are the labor market development, supporting research, and of course improving the economy competitiveness. But the main idea, the centric idea, it is the human. The strategy is human-centric, and all the initiatives that are further will be introduced in alliance with the strategy must be human-centric. The sectors that are prioritized to the moment are health, transport, and production. This year in spring, we also saw the concept on AI regulation, where the main principles for further regulations in the field were introduced. And also one of the regional initiatives, it is the establishment of the special regime. The Moscow was chosen for development and progressive adoption of artificial intelligence. But what is needed, it is synergy from collaboration of the state, researchers, and business. And more, and of course, this balance is achieved, and of course I hope that it will also further regulational governance development in this track will be also in this synergy. But what are the main challenges? These challenges are faced by all the majority of the countries that are working on AI. At first, how to find the balance between humans and AI technologies. Because it is very important to find this balance between security, use of the private data, and of course, not to violate the private life. Another issue, how to push and support the competitiveness in this field, also taking into consideration that we all live under the matrix of global value chains and now data value chains, how to find this balance between the large transnational corporations and their search for data and national production and national advances in the AI field. Also, that is very important for all of the countries and, of course, for BRICS countries to find the balance between data and AI science, and also business and the state. So to make technology work for human, not human for the technology. And, of course, at this stage, the transparency in technology use, in technology adoption must be reached. And, of course, security at all the levels, private, national, regional, sectoral, and so on. So, with regard to the issues that could be the matter for tracks for further collaboration with BRICS, it is further done ongoing work on transversal AI, certification in AI field. Here, Russia is also actively working with developed economies and BRICS economies. And one of the burning issues for the discussions and for that is basis for the further soft law development, it is AI ethics. So, as with regard to the possible tracks for further collaboration, it could be science and education in different branches of science that are related to artificial intelligence, from natural science to liberal arts, that are all needed for further development of artificial intelligence and finding the balance in governance. And one of the tracks could be like first steps with regard to AI ethics. It could be the codification of ethics in AI field. There could be different approaches, sectoral or focused on concrete projects. And in this regard, I would like to share with you the basic approaches that could be covered in codes of ethics that were introduced in IEEE this year with me and my colleagues in our research publication. So we should act in the interest of the society. The law should be respected. Also, citizens and societies must be respected when we are talking about AI ethics and the application of AI in concrete fields. Of course, our responsibility, then we would like to share as one of the main principles, the need to act with professionalism and competence, and also to strengthen the public trust in AI. So I was trying to be brief. So thank you for your attention and looking forward for the further fruitful discussion.
Anna, thank you. Was not only brief, you was quite ahead of your time. So it's even 3 minutes left. So thank you for this insight and especially for your vision of the new edition of Asimov Laws of Robotics in the relation to the artificial intelligence. Let me stress just a couple of ideas that you mentioned in your presentation and which I think to be very important, especially for BRICS. This is one of course, this digital divide issues, because this is something that we should be very careful about. And this is one of the problems that was very extensively covered by the United Nations, for example, the editions of the Conference for Trade and Development editions and so on. And the other issue, in my eyes, of extreme importance, this is the development of a new, what may be called PPP plus format. So this is public-private partnerships with the more inclusion of general public, non-governmental, non-for-profit communities in the development of both ethical and other issues, which is really the new, goal for our mutual cooperation. But now let me pass the mic to Professor Herbert Kimura in the University of Brasilia, Brazil. Professor, the floor is yours.
Okay, thank you very much. Let me see if I can share my screen. So can you all see my screen? I think so, yes. I have the computer here, I can see it. Okay, thank you very much. Good afternoon, or evening or morning, depending on the time zone you are in. Thank you very much for the introduction and for the invitation. It is an honor to participate in the 2020 BRICS Academic Forum. It is a privilege to share experiences with international experts regarding regulating digitalization and artificial intelligence development. Since we have only a few minutes for our presentation, I will focus on discussing some characteristics of Brazil, trying to contextualize challenges for the advance of artificial intelligence in the country. So in this first slide, I will bring a brief overview of Brazil. The country is located in South America, relatively far from the other BRICS countries. Brazil is the 5th largest country in the world with 8.5 million square kilometers and the 7th most populated nation with more than 211 million inhabitants. Sorry for the, the mess here. Our country is the 8th richest economy with a gross domestic product of almost $2 trillion US. Although in absolute values, Brazil can be considered a rich country, per capita, our wealth is only the 72nd in the world. Oh, sorry. Sorry. So in Brazil, Brazil is a big country, and we also have big problems. So from an academic perspective, we have more than 11 million illiterate people. The scenario impacts our potential to train professionals in emerging and highly technical knowledge areas, such as artificial intelligence. The unemployment rate is another huge challenge we are facing now. In the beginning of the year, we had 12.6 million unemployed persons. Due to the COVID-19 pandemic and other structural problems, Brazil has now 13.5 million people looking for jobs. So from a social perspective, 40 million Brazilians do not have access to treated water. And before the pandemic, 45 million people did not have a bank account. So this number decreased to 35 million due to the government's effort to give financial assistance to the population in need of aid during this pandemic. In contrast, as Brazilians are very sociable, they like to talk and interact. So the number of cell phone subscriptions and internet usage are relatively high, as discussed in a previous panel in this conference. However, we still have 47 million digitally excluded persons. So this is a brief overview of the country and some general challenges. We have a high unemployment rate, high economic and social inequalities. A significant number of people do not have access to good education, to the financial system, or to the internet. Many families struggle to even get clean water and food. So these general challenges make it more difficult to the country to play a leading role in the advancement of artificial intelligence technology in a global market. However, specific characteristics of the Brazilian context also pose challenges. Let me see. So there are specific obstacles to building a dynamic environment that could foster the development of artificial intelligence in Brazil. First, the country lacks human resources. The number of engineers, computer scientists, data scientists, and other technical related professionals is insufficient. This issue was already discussed by Luis Kubota from IPEA in a previous presentation in this conference. Brazil does not have enough skilled workers to cope with the demand of the fast and competitive market of artificial intelligence. The country has a concentration of college students in other fields, such as law and management. To make things worse, highly skilled professionals in AI are getting job proposals to work in foreign countries. In addition, the country cannot make investments that match world leaders' spending in the race for AI. Government expenditures, as well as public debt, are high, and due to the COVID-19 pandemic, the fiscal deficit is worsening. Although public budget is very limited, there are many governmental initiatives to fund AI projects. However, available public funding is way lower than the investments the other countries in the field. So private funds are also limited. Usually Brazilian firms do not invest in research and development. Since historically the primary interest rate in Brazil was very high, business owners would not put money into innovation. However, since many AI applications do not require expensive hardware or sophisticated devices that could be subject to embargoes, barriers of entrance are not high, bringing opportunities for emerging countries. Another challenge for AI in Brazil relates to regulation. Recently, a new guideline, the General Law for Data Protection, was enforced. This regulation introduced many requirements that firms must comply to. Since changes are significant, developments in AI may be delayed as companies have to first assess impacts of the law and then adapt themselves to the new rules. In this context, regulation may lead to a more secure and fair use of data in AI applications, but a slower development of the industry. Finally, another challenge facing the AI sector in Brazil relates to the need for a country-wide integrated strategy. Despite the sanitary and economic crisis, there are private and public organizations in federal, state, and municipal level that foster and fund innovation. Startups, including the ones that explore AI, are getting investments and professional advisory to develop and market their solutions. However, many initiatives are fragmented. A coordination of efforts could create synergies, making investments more efficient. Particularly, Brazil could better explore the triple or quadruple helix concept. The idea of government, private sector, academia, and civil society working together to enable innovation is paramount. However, there are some obstacles. For instance, there's a distancing between academia and the private sector. Since researchers have their performance measured by academic outcomes, such as number of papers or citations, they are not usually tuned or concerned with market demands. Many enterprises do not even look for knowledge that are being generated in the university and research centers. In addition, one important feature of the Brazilian academic environment is that professors from public universities are subject to specific working rules. These rules make it difficult for professors to work for and with companies. All interactions of professors with the private sector are scrutinized and not really encouraged. Therefore, an integrating strategy within the context of a triple or quadruple helix is not easy to implement in Brazil. As you can see, there are many challenges for Brazil to become an important player in the AI market. But the main challenge is to make AI available and useful for all people. Society will have to ensure that efforts of AI development will be beneficial to everybody, especially those that are the most vulnerable. AI should address problems of people that do not have access to treated water, to a bank account, or to the internet. And AI should not exacerbate prejudice or social and economic inequalities. So, I hope I could give you an overview of the context of AI challenges in Brazil, and I thank again for our invitation to participate in the panel. I'm grateful for the opportunity of sharing the Brazilian context and learning from the experience of other BRICS countries. Thank you again.
Thank you, Professor Kimura. Obrigado. So thank you for this very extensive review of the Brazilian challenges, and let me comment that considering the science, technology, innovation studies concepts, when you have a challenge, you also always have an opportunity. So from this point of view, there's not always great room for improvement, but also a great room for innovation, because this grassroots innovation, be it very simple things or much more complicated technical ones, always arise from the demand, not only from the supply side. And from this point of view, I guess a very interesting example may be presented by India with its frugal innovation practices and so on. And this drives us to our next speaker, very organically, I would say. So Dr. Urvashi Anija, who is co-founder and director for the Tandem Research, this Indian think tank, and who has an extensive experience both in analytical field like World Economic Forums and Chatham House, and the dialogue and discussion with the decision making, as far as I can get and grasp from her CV. Dr. Anija, the floor is yours. Welcome.
Thank you, Dr. Ivan. It's a pleasure to be here. Thank you for inviting me. I'm going to share a few slides with all of you, so I'm just going to share my screen. And in case there's any technical trouble, you can just indicate, but hopefully that should be fine. Great. So can you see my screen?
Yes. Thank you.
So I will start. So what I'm going to do is present an overview of how some of the conversations around AI policy are playing out in India, and in some sense build on some of the remarks that the previous speakers also made around the opportunities, around the challenges, and some of the critical governance conversations that we need to be having to ensure that AI delivers positive social impact. So just to give you a quick overview to start with, so in 2008 is when the Indian government released its national strategy for AI. The strategy is called AI for All. And the emphasis on that strategy was on trying to identify ways in which AI could be used to fuel progress in key social sectors, so health, education, agriculture, smart cities, etc. And the Indian government, as part of its strategy, also envisaged India as a garage for developing AI solutions for other developing countries, given the similarity in socioeconomic problems and the broader institutional context. And since then, we've seen a growing amount of interest within the Indian policy apparatus on AI. We've seen increases in government spending. We've seen the setup of centers of excellence in multiple cities in India. And most recently, and I think this is it goes to show how the thinking on AI has also evolved within the Indian context. Most recently, the body of the central government also released its vision for responsible AI, so a draft document for what responsible AI looks like. And India has recently joined the Global Partnership on AI to promote responsible and human-centric AI. AI certainly brings or promises a number of opportunities for the Indian context. I think many of them are similar to what exists for other countries in the global south, other BRIC nations, and some of it was mentioned by the speakers before me. There is expected to be economic benefit in terms of the addition to the GDP, as well as to fuel innovation in critical sectors such as healthcare, agriculture, education, mobility. And I think one of the really interesting and unique opportunities or use cases for AI in India is also the ability to overcome linguistic barriers. So as you all might know, India is a very, very large country and we speak many, many different languages. And the ability to use machine learning and NLP to be able to overcome these linguistic barriers could play a very important role. And we're already seeing that, whether it's through voice applications or other translation applications. And also the expectation is certainly that it will help improve efficiencies across different businesses and sectors. So I think there's a tremendous amount of opportunity that AI can bring to the Indian context, similar to other countries in the global south. But there are, I think, a common set of challenges, and my colleague from Brazil, I think, pointed to a number of them, and we see similar challenges in India. There's a lack of digital infrastructure. There's shortages in computational power and storage capacity. There's a huge issue in terms of the lack of availability and access to data. So even though India is seen as a data-rich country because of the large population, much of this data is fragmented, it's unstructured, so getting quality data is hard. And there's low levels of skills in terms of being able to build these AI solutions. And the last point I think is particularly important here, which is that there's low levels of institutional capacity. So what I mean by that is that we already know that technology typically outpaces the pace of policy development. And in the case of AI, we see that happening very clearly. And that there isn't enough, that we don't have enough capacity at an institutional level to be able to regulate AI so far. Some of the risks I think are about AI are very important to note, and this is not just because, this is because it's important to address these risks early on at the innovation process, in an upstream process, so that we're not just plugging harms as and when they happen. I think there are severe risks to privacy and civil liberties. I think it's pretty well established now that with advances in machine learning, anonymization as a technique doesn't quite work. I think there's also a good amount of evidence to show that it has a disparate impact on marginalized communities. In a country like India, the threat of job loss is very real. We have a labor surplus economy, and we have a large low-skilled population that is doing some of the entry routine kind of jobs that are susceptible to automation. And then I think there are risks around cybersecurity, very, very, very real risks around cybersecurity, as well as around surveillance, right? So there are a number of risks, and we need to think about these risks as we think about the opportunities as well, to make sure that we don't create unwanted technological or societal lock-ins. I'm going to move from there actually just to the last. I'm going to skip over a couple of slides and come straight to the governance point, because I think that's the crux of our conversation here. And I just wanted to make a few points around this, right, on what I think are the important pathways or important ways to think about the governance of AI. So the first one to me here is that I think, we've seen in recent years a growing emphasis on technical approaches to governing AI, so around fairness, accountability, and transparency. And I think these approaches, while important, are inherently limited. So fairness, for an example, to me, cannot be an attribute of a technical system, but it is an attribute of a social system. So what is fair in the Indian context might look very different from what is fair in the Russian context. But a lot of the solutions that we're using, a lot of the AI products that we're using are kind of being bought off the shelf and transposed across multiple contexts. So technical solutions are important, but there's a limitation. Similarly, ethical approaches, like our first speaker mentioned, are also very important. But I think, again, there is a limitation. And the limitation here is that it ends up relying on self-regulation. It expects companies to regulate themselves and choose what is the most ethical approach. And I think we already have a growing amount of evidence in the digital ecosystem that self-regulation doesn't lead to the most societally beneficial outcomes for society. I think just picking up the front paper of most newspapers, or at least turning to the tech section, you get a very good sense of where some of the self-regulatory approaches have their limitations. I think what is really important and what is missing from a lot of conversations around AI is that we need to decide a threshold for regulatory intervention. So what I mean by that is, what are we trying to govern? Are we trying to govern AI? AI is a huge word, right? So are we trying to govern machine learning? Are we trying to govern deep learning? Are we trying to govern the use of algorithmic decision-making systems? Are we trying to govern an Excel sheet? Even Excel sheets make decisions, right? So I think it's really important to decide that threshold for regulatory intervention. And to me, that threshold for regulatory intervention should not be the technique, the computational technique. So it's not about whether it's machine learning or whether it's deep learning or whether it's an algorithmic decision-making system, but that threshold should really be on the societal impact. And I think we need to measure that impact across four axes. We need to measure the impact on people, so their rights and liberties. We need to measure the impact also on markets. So what does the introduction of AI mean for healthy competition and healthy markets? We also need to measure the impact in terms of democracy. So how will the introduction of AI change state-society relations? And finally, we need to assess also the impact on the environment. AI solutions will come with a considerable environmental impact, and that might mean that they're better used in certain kind of contexts and ill-advised in other contexts. I think if we're thinking about governance, it's very, very important that we make investments in state and regulatory capacity, particularly in countries in the global south, and equally that we make investments in the analog components of the digital society. So similar to the speaker before me, thinking about that digital divide and how we address it is really key. I do think we need to draw certain red lines around certain types of use of AI, certain types of biometric use, the use of AI for mass surveillance. I think some of these are instances where we need to draw certain red lines, or at least ensure that we have adequate checks and balances in place. I do also think the data protection frameworks are extremely important, but data protection frameworks, as they're currently envisaged, focus on the individual and consent. And as we know, it is not only individual privacy that's at stake, so we do need to think about frameworks for community rights as well as accountability. And finally, I think a lot of the conversation around AI governance is focused on risk management approaches, so addressing specific instances of harm. I think that is important, but we also need an upstream management of the technological innovation process. So we need to have both risk management approaches that address downstream challenges, as well as upstream interventions that govern innovation and the process of innovation, so that we create a more fair and equitable AI ecosystem. So with that, I'll come to a close, and thank you very much for your time, and I look forward to your questions.
Dr. Thank you very much for your very insightful and thoughtful presentation. What always makes us, very impressed in Indian look at an Indian view of technology problems is that they are not alternative but different from some general Western considerations. So it's always inclusive, it's always green, and this really the matter which we use discussing the AI in my eyes. Thank you for very important ideas, starting from the inclusiveness and up to agency that you rose up. And just let me stress one important idea that you stressed also in your presentation. This is about the new culture and new realm of governance for the AI, which is no more the just business as usual regulation for the government and for society, but a very new frontier of it. Because, for example, what we see in some European countries, in some, for example, other Western nations like the United States of America, all for now more and more looks alike of the fight between digital corporate leviathans with big digital brothers for big data and personal information and so on. And this is, of course, also important considering the antitrust regulation and so on, but this shouldn't be the only focus for the governance of AI and other advanced digital technologies. And once again, thank you that you get so thoughtful insight in these governance issues. Now let us move to China, to the person who is not only discussing artificial intelligence, but as I can grasp from his CV, also actively engaged in its development. This is Jai Jan. He's engineer in artificial intelligence department of Cloud Computing and Big Data Research Institute, China Academy of Information and Communication Technology, China. Mr. John, the floor is yours.
Thank you. Can everyone hear me?
So we can hear you.
Okay, so then I will share my screen. Wait a minute. Okay, then can everyone see my screen about the presentation?
We can see.
Okay, thank you. Hello, everyone. My name is Zhang Zheyu from China Academy of Information and Communication Technology, and it is a great honor for me to have the chance to deliver a speech about trustworthy AI promotes the development of AI governance in the next 10 minutes. AI is currently being widely used in many application scenarios like smart home, finance, autopilot, while causing great changes and benefits. AI has further increased ethical risks like safety and discrimination, also bring the challenges of the governance. The current global AI risk prevention and control mechanism and the formulation of the rules are relatively lagging. So in this case, AI governance has become an inevitable result of the development of AI technology and application to a certain stage. And in recent years, human-centric has gradually become the core idea of the development of AI and corresponding governance principles. So what should AI governance do? So we think the AI governance should AI I can hear my echo. Sorry. So AI governance should take AI to benefit mankind as an overall goal. This means we need to continuously release the technological dividends brought by AI, also to accurately prevent and actively respond to the risks that AI may bring. So the key to AI governance is to balance the development of AI innovation and effective governance. To achieve the expected balance, To achieve the expected balance, we believe the co-governance with multiple parties' participation is very important. The multiple parties should include the national government. This is a co-entity that implements the governance rules. The International Intergovernmental Organization, which can play an important role to guide the direction of international AI governance. The industry organization could be an active promoter of the coordination of multi-party governance. And enterprises, they are the backbone of the practicing industry self-discipline. And the public, this is also an important participant in monitoring the effectiveness of the governance. And when implementing the governance, we believe the multi-level and diverse methods are also needed. The ethical constraints can embed the ethical values like benefiting mankind, avoiding harm, fairness, and justice into AI in order to provide value judgment standard for the development and application of AI technology. Laws and regulations are important means of governance, and they should be, for AI, should be inclusive, prudent, and flexible to maintain the balance. And technical response is also very necessary, since technical issues should always be tackled by the technical method. So AI itself could be also developed as an accurate and intelligent governance tool. So since AI technology and applications are not yet fully developed, we should distinguish different stages of AI governance. At present, we think developing self-discipline of industry through trustworthy AI perhaps should be the focus point of the current AI governance. So the trustworthy AI is more depending on the means like convention, guideline, standards, platforms, technologies, and other methods. And all these methods are very effective in finding the balance between the innovation and governance. For the future, then we can rely on the basis of the industrial practice we have already had to adjust the legal system gradually. So AI contains many features at the technical and social levels, resulting in a wide range of coverage and difficulty for implementation of the AI governance. So how to develop trustworthy AI and make it more practical at the current stage? There are three directions worth consideration. The first is to adopt flexible, trustworthy AI rules based on the current development of the AI industry. And second is to launch pilot projects to promote construction of the trustworthy AI industry ecosystem. And third, all parties need to actively cooperate to promote international trustworthy AI to form a consensus. So here, I would like to share some of our experience and work on developing trustworthy AI. In last year, we published the Self-Discipline Convention for Artificial Intelligence, which objective is to help enterprises have full understanding of AI ethics and regulate their behavior through self-discipline at the same time. Until now, the convention have gotten positive responses from more than 150 companies in China. And from the beginning of this year, we started to refine the guiding principles of the convention and deeply investigate the industry experimental experience from many leading AI companies in order to land the convention through a more practical and a more implementable way. Then we published trustworthy AI implementation guidance in the middle of this year. And this document, we believe, can be used to guide the trustworthy AI implementation practices. And we are also carrying out trustworthy assessment regarding AI products and services according to the requirements and suggestions proposed in this document. And the pilot phase has already been completed in last month. Additionally, we are collecting trustworthy AI testing tools, which can be used for the assessment I mentioned before, and also can be used the further AI certification. And we hope this kind of work can encourage AI open source and make trustworthy AI technology can be used by every aspect in the AI industry. And so we believe all of this work around trustworthy AI we are doing now is a very good starting point to promote international cooperation by showing our doing on trustworthy and AI governance. So AI has the characteristics of a cross-border and international division of labor. So it is necessary to build a global AI governance community. So we hope every government and organization should seek effective ways to solve AI risks and complement each other to eventually achieve a goal of win-win cooperation on the AI governance. That's all for my sharing. Thank you.
Thank you. Dear John, thank you for your presentation. So this is really one of the most important things considering the development of AI. I mean, the self-regulations and all of the issues that you rose up in your presentation concerning the trustworthy internet and AI technology. And it is extremely interesting and extremely important because the regulators are always following the development of technology, while it is corporate and research institutions that should take a lead in the development of these ethics and other governance codes. So this is definitely the thing that we should support. Also, let me stress two important ideas that you also mentioned. First one is the pilots, which are important technically and regulatory to develop new rules to assess the effectiveness and test all the approaches that we're speaking about, and of course the international cooperation, because one of the undoubtful pluses of our forum is that we can share in the BRICS format this international experience, views and approaches, and this is very extremely important in the new era of digital transformation, where everything sometimes look quite vague and not always all answers are at hand. So once again, thank you for your presentation, and let's move to our last but definitely not the least panelist. So this is Louise Leinen, who is associate researcher, a member of South African BRICS think tank, professor of University of Western Cape in South Africa. Louise, the floor is yours. Welcome to Moscow.
Thank you very much. Thanks. I wish I could be, but good afternoon from Cape Town. Will have to do for today. I'm just sharing my screen. Just a sec. Let me just try again. There we go. Just trying to get there. I hope you can see it.
Yes. Yes. You.
Okay, then I'll start. I'm going to refrain from repeating what the previous 5 colleagues have said. I'm going to focus on some of the points I've summarized on this slide. The most important aspect for me is that we need to constantly keep in mind when we talk about AI regulation that AI digitalization and then increased connectivity that comes with digitalization and cyber security are always interlinked. The one impact on the other. So we can't look in a silo, for instance, at AI regulations or cybersecurity regulations, because when we have growth in digitalization, we have an increase in cybersecurity risks and threats, and then we can counter them with AI applications, but AI applications also cause some cybersecurity risks. One example is, for instance, when autonomous systems, for instance, self-driving cars can be hacked and changed into weapons or threats to society. So there are a lot of aspects that we need to keep in mind. And also, it's been said over and over again in all the BRICS panels, we cannot work on our own, not the BRICS countries and neither regions. So we need to also focus on interoperable standards. That will have a long-term benefit if you can share information in an automated way, but we need to be able to understand, and our platforms need to talk to each other. So we need both common vocabularies and interoperable standards. And then I'm going to look a little bit at the status of both cybersecurity regulation and AI regulation. And some of the speakers have given summaries of what's happening in their country. So I promise I won't repeat all of the contents that they've already mentioned. So if we just have a quick look at cybersecurity regulation and legislation, a lot of progress have been made. The light blue color is the best one, where there's a high commitment to cybersecurity in a country, and we can see BRICS countries does relatively well. Brazil and South Africa sits at a medium level, but this statistics is from 2018, so some improvements have been made or some progress have been made since then, and it's constantly changing. But one thing to note on this slide is that Africa has a lot of dark spots there in terms of no legislation or very little or low commitment to cybersecurity. And because we're part of bigger regions, it is important for us to also pay attention to what's happening in our regions. And then just a closer look at the African continent. On this slide, also from 2018 statistics, we can see the countries with substantive provisions are the green colors, and then we have medium, and the red spots are the problematic colors. But I'll talk a little bit later about the progress that have been made in South Africa in terms of cybersecurity legislation, and that includes privacy legislation as well. But let's move to national AI strategies. We've already heard a little bit of what's going on in some of our colleagues' countries. And here we can see the countries that have made the most progress are the darker blue-colored countries. And Brazil and South Africa needs to work hard on this aspect of AI regulation, and we're hoping that we can rely on our partners to share the processes they went through to actually get national AI strategies in place. Well, we're not starting from scratch. All BRICS countries actually agreed to the G20 AI regulations that was agreed upon in 2019. These are fairly broad principles, and it does cover the things that have been discussed by the previous speakers. So it's trustworthiness, accountability, ethics, etc. And then the second part of these AI regulations focus specifically on the development of national AI strategies. And in countries where the national AI strategy already exists, we can't sit back because these regulations can never be static. AI continually advances, and as it advances and changes, it will require change in our regulations and how we view them. And obviously there will be cultural and local specific requirements in terms of either cybersecurity or AI regulations. But I do think it's viable for countries and organizations such as BRICS to actually discuss common values and common regulations that apply to all of us, because it will save us work in the long term, and then we have those benefits of being able to share our information or our systems with each other. Now this is a slide again with just a brief summary of the status. We've heard about advances in Russia and India and also in Brazil, and more detailed information concerning China with the previous speaker. In South Africa, we're lagging behind. Some advances have been made in terms of AI moving towards a national AI strategy by the establishment of a Fourth Industrial Revolution Commission by our president last year. And on 6th October, a few weeks ago, they actually did publish a draft report with 8 priority areas on which South Africa will focus. And 2 of those priority areas are in health systems, AI health systems, and manufacturing. And I think we can benefit a lot from the experience of our partners in BRICS in those regards. I also said I'll give you a brief idea what's happening in South Africa in terms of cybersecurity legislation, just very briefly. We have a Protection of Personal Information Act that was enacted in 2015, and in June this year it's now enforced, and offenders can be prosecuted. And after a very long period, starting in early before 2010, we now finally have a cybercrimes bill, and it's lying on our president's desk ready to be enacted. So we have at least made some progress in that regard. And then I'm going to move to my recommendations. I think it's necessary to have specialized groups in BRICS that discuss these regulations. On the one hand, cybersecurity and cybercrime, see what changes are needed. But I think a lot of work can be done in common discussions regarding AI regulations. Thank you for your time.
Thank you, Louise. And special thanks for stressing the question of the cybersecurity issues along with the trustworthiness of the internet. It's really one of the most important questions for the regulations to come. And considering the South Africa experience, as you may know, there is, well, a bunch of literature considering the smart second movers who can build the efforts, as you put it, on the experience and sometimes on the flaws of those who come first. So we're very thrilled to see the next regulations of South Africa on cybersecurity, on artificial intelligence, and hope for the best that you will share your knowledge with us too. So now we're moving to our discussants, and the first one will be Nanlan B, who is Associate Researcher. Yes, hello, we can see you. So Associate Researcher at Chinese Academy of Science and Technology for Development. Lan, please.
Yes,
yes. Is yours.
Okay, I will share my screen. And yes, good evening, everyone. Dear hosts and experts, it's my honor to join this session and share some research progress on this topic. And my topic today is ensure the benefit of digitalization for inclusive growth and sustainable development. So I'd like to introduce some China's inclusive innovation practice in my discussion panel. Okay, let's keep on. My content including 4 parts, but I'd like to share only 2 parts as the time limited. The first one is the research background, and the second one is China's inclusive innovation experience. Okay, as the development of science and technology has significantly improved people's living conditions. However, the people still face some challenges from social problems, such as the unemployment, poverty, social inequality, and ecologic environment. So the development that has been achieved is not sustainable. This problem are unable to be solved by the existing policy framework of sci-tech and innovation. So it's necessary to explore a new policy framework for the development. And this is the SDGs from the UNESCO. And so based on the research background, we want to solve the social problems in China, especially in the poverty alleviation and disparities between the rural and urban regions and income distributions. So China, now we have 5 concepts for development. There are innovative, coordinated, green, share, and open development. That is for everyone. Okay. Let's skip the literature review. So now China's inclusive innovation operates at 3 levels. The first level is improve the public welfare of the poor, and reduce. It includes 2 aspects. That's reduce the living cost through innovation and industrial development. The second one is popularize science and stimulate the public entrepreneurship. The second level is narrow the gaps between urban and rural areas, especially closing the income gap is the key point. The third level is pay more attention to reducing environmental and social risks. So there we can see the triangle of this three division. And okay, now here's the experience of China's inclusive innovation. We have two modes. The first one is top-down, which means led by the government. The second one is the bottom-up, which is led by the enterprises. Based on the top-down model, we can see the two cases. The first one is the National Experimental Zone for Sustainable Development. The second is the SciTech Special Commissioner System. And okay, I will explain them later. The second mode is the bottom-up, led by the enterprises, from which we can see Pinduoduo is a shopping. It's a shopping mode similar to Taobao. The second is a video mode named Kuai. Maybe you can compare the Kuai like TikTok, and that's I think that's the inclusive innovation mode led by enterprises. We can use more digitalization method for the inclusive innovation. For the case one is the National Experimental Zone for Sustainable Development. We have some mechanism led by the Ministry of Science and Technology. We start up the National Experimental Zone for Sustainable Development in 1986. It's led by the government and multiple subject participation top-down. We have 3 levels of management. And till now, we have 3 stages of the National Experimental Zone. It includes the following stages. Okay, for the time limited, I will skip it. This is the rollout of this zone for the whole country. You can see from the map. And also we have some achievement which help a lot for the whole country in different levels. The second is the SciTech Special Commissioner System. We have this system was set up in 2012 by Ministry of Science and Technology. For the aims of this system is to send the science and technology to the farmers and help farmers to solve the problems in the agricultural production and operation. Also help them to acquire capacities to get rid of poverty and increase their income, and also explore a new path for the socialization of agricultural science and technology. On the right, you can see some pics. And yes, you can see there's a big number. It's for the commissionaries who went to the rural areas to help the farmers. And this is the third one. The third case led by the enterprise. The enterprise inclusive innovation based on the internet, which help a lot for the low-income consumers. Social network. Pinduoduo is an internet platform for shopping, and which was set up in 2015, and 433 million consumers and 3.6 million entrepreneurs using shopping together to meet the consumption demand and to lower the product's cost. And it's very attractive. You can see it's also one of the top 3 e-shopping platform listed in NASDAQ in 2018. And so this is a third case. And for the fourth case is the Kuai. This is a video. It's a video company. which empower the individuals and improve the social well-being. If you have interested in this field, you can check the website and you can see so many short videos, and from the production innovation, for the process innovation, and also the social innovation, which helps the poor people a lot for their well-being. So it's a little conclusion. I think how to ensure the benefit of digitalization for inclusive growth and sustainable development for all. I think for China's good experience is basic on the three key elements. That's the popularization of mobile phone and the mobile network and base station construction. And the third is mobile payment. So everyone who comes to China, you will be amazing by all these three key elements, I think. So for the future, we still have some challenges, which is to pay more attention to the regional and group differences in inclusive innovation. And second is to build appropriate and complete policy system according to the different stages of innovation. And the third is balance the innovation risk and benefit. That is all for my speaks for these topics. And this is the last page, so I hope you can pay more attention to my academy. This is the website, and the last is my email address. So also we are now we belong to Ministry of Science and Technology, and also we are one of the 29 China top think tanks. And also we are running International Research and Training Center for Science and Technology Strategy under the auspices of UNESCO. We are running some training program every year. Please pay attention to our institute. Thank you very much.
Thank you, Professor B, for your very important insights in the Chinese experience for the inclusive innovation, digital innovations. Now let me pass the word for our last panel discussant. This is Mr. Vadim Krasulin, who is Program Director for the New Technologies and International Security in Russian Peer Center. That's one of the most authoritative think tanks in Russia. Vadim Borisovich, the floor is yours.
Thank you, Mr. Chair. Thank you to all speakers. It was very interesting for me to take part in this event and listen to distinguished experts from so many countries, and have a chance to look at our common domain from different angles, from different corners of our globe. But I noticed that we have plenty in common. Development of digital economy is a topical issue both for each of BRICS member countries individually, and on the same time for Institute of BRICS as a whole. Nonetheless, BRICS countries have different levels of development of digital economy, and it's a subject which has to be explored, which provides a lot of information we need to exchange. When listening to your presentations, I made several notes, and I noticed that though we have different views and different data and information, we have several things in common, and I would underline them, like what are the offers by several speakers, deepening the dialogue and exchange of best practices in promoting digital development, development of common standards for production of digital goods and services, promoting common interests of BRICS countries in ensuring global information security, and exploring, studying and combating, so I would call, side effects of AI technologies. development of, I will discuss those issues one by one, if you permit. Development of dialogue and exchange of best practices, information and experience in promoting our cooperation between BRICS countries in the digital sphere. That's an important issue. BRICS doesn't have a specialized mechanism for constant exchange of relevant information or even general parameters of development of digital economic components in partner countries. So digital economy, artificial intelligence became a separate issue within BRICS platform just 5 years ago. Before that, it was a part of other issues like economic issues. It's a fresh point where we start our discussion, and I think we have a lot of opportunities and I would say duties to perform. Second, BRICS countries have achieved progress in development of common standards for the production of digital goods and services, but to date, universal standards for production of digital products have not yet been presented. So that's another field which we can and we should try to discuss and find our common approaches. Another promising area of cooperation is the joint promotion of interest of the BRICS countries in the field of international digital security. I noticed that especially our female participants were very much concerned about what I call side effect of AI. For example, my Russian colleague, Professor Abramova, she mentioned humans versus AI technologies. Our colleague from India, Mrs. Anejas, she said, evaluation of social impact of machine learning applications. So I would say that it's really a new phenomenon which we face, which hasn't been examined, and which might cause us plenty of problems. Side effects, or maybe we can call it collateral damage, differences in perception of AI in different countries. It's our opportunity, we all present different countries, and we feel that technologies actually intrude in our biosphere, which is mainly to the better, mainly to good, but sometimes it's a little bit alarming. Sometimes it's alarming. To some extent, we can assume today that it's not technology which is embedded in the human society, but actually it looks like society itself is embedded into technological process as one of components. Technology covers public administration, military field, medicine, and so on. And people gradually become a source of data. I remember at the beginning of the century, there was a saying that humans or people are the new oil, which means people are the new asset of the 21st century. Nowadays, I hear a bit different phrase. Data is the new oil, gas, platinum, and so on. So data is more valuable, and we are the source of data, which probably sometimes might be not so good to our civilization, to our mankind, and to our culture, which is so valuable to us. Each of us have their own things, our history, our traditions, which are valuable to humans, but are they valuable to technologies? Are they valuable to designers, to IT specialists who produce those products? As far as data is being produced in huge amounts, culture, our thousand years culture might become a handful of bytes in the huge ocean of content. That's the problem. And I noticed, I wrote down that our colleague Lalang Bishi said that social problems in China are connected to technologies. Poverty, disparity, difficulties in employment. We also noticed that regional and group differences, that's another issue to study. We have different approaches to technology, and I think that it's quite interesting field to be explored. And I am thankful to Mr. Jan, who said self-discipline convention for AI. I am quite interested to know the content of this self-discipline convention, how it works, what it means. Self-discipline means technology have to observe its rules, which are established by technologies themselves. Well, I think that's actually issues to you, but mainly to myself. I'm not finishing my work today after we close our event. I'll continue examining the content of our conference, and hope one day we'll have a chance to meet in person and continue our discussion and share our views and findings. Thank you for your wonderful presentations, and hope to meet you in Moscow or somewhere else again. Thank you.
Thank you, Professor Kazulin. Because of the technical delay in the beginning of our event, we don't have enough time for questions. So let me finalize our today's section with several brief ideas. First of all, of course, thank you very much for your very thoughtful, insightful presentation. Let me just stress a couple of ideas that was like a buzzwords in all our discussion. A couple of years ago, the World Bank released the study considering the Russian digital transformation, where it was presented as a three-stage process. First of all, you correct your processes of management and governments using the digital capabilities. Then you use advanced digital capabilities to create new processes. And finally, on the third stage, you recreate your governance and management, considering the capabilities and new frontiers of development that is provided by the digital technology itself. However, this techno-optimistic and somehow even transhumanistic view is just one of the possible approaches to the digital transformation. And I guess that our section today released not maybe an alternative, but additional view on this issue, because governance and management is always a two-way street. So whatever digital, the economy stays economy with humans inside, with the social issues, challenges, environment, inclusive growth, and so on. And these two strains of governance should somehow meet each other. And there are at least several layers of the discussion that should be initiated in order to create not perfect, but optimal governance and management systems for the AI on the national and the international level, starting from the citizens and research, expert dialogue, and up to the international communication between both experts and decision makers. And let us thank the organizers and the BRICS format that this is one of the forums that where we can approach this goal of sharing not just ideas, but also approaches, vision, practices, and lessons learned from our experience. Thank you all, and as Professor Kazulin already told us, so we hope for the best. We hope for you to stay safe and secure from the pandemic risks, and finally to meet each other, be it in personal or in digital space, to discuss these issues further and to prepare new recommendations and new visions for the decision makers and general public. Thank you very much.